Call the Health Committee to order. In the previous business, could I get a motion to approve the previous meeting minutes? Motion by Joanne, second by Gary. All in favor? Any opposed? Thank you. Moving on to current business. Number 1, Resolution 336, a resolution to initiate a pilot polystyrene recycling program.
He's not here. Table at his request.
Okay, thank you. Tabled at the request of the sponsor. Number 2, amending resolution number 145 for 2017 regarding the New York State Department of Health Million Hearts Program. Dr. Wellen?
Good evening. So we are requesting permission to just move forward a date on this contract, which was undertaken through the state DOH, and it's a hypertension initiative. We're working with the community partner to stress the importance of hypertension awareness and public education campaigns on aspirin for those at risk, blood pressure control, cholesterol management, and smoking cessation.
She's looking to extend the program.
It's a no-cost extension.
Sure. Any questions for Commissioner O'Malley? Hearing none, can we get a motion to approve? By Brian, second. By Joanne, all in favor?
Aye.
Any opposed? Unanimous. Number 3, amending resolution number 338 for 2014, reflect the reduction in the original grant funding amount for tuberculosis prevention and control.
So
Dr. Wellen.
unfortunately, our next two are for budget cuts that have come about as a result of the budget cuts at the state and probably federal level as well. And this is for the TB grant, and it is a cut of approximately $10,000, which we have put into the budget for 2018-2019.
Okay. I'm sorry, Doctor, a cut of what amount?
10 from last
Oh, 10, I see it.
From
Almost
48
$10,000.
to 39.
Any questions for Dr. Whalen?
Mr. Chairman, yeah. We originally had the contract for more money, and the state is now telling us they're not going to give us as much money. Is that it?
That's correct.
Well, why do we have contracts then? What am I missing here? Isn't the contract for a specific amount, aren't they held to that?
Well, the contract is renewed on a yearly basis.
Our year multi-grant award, but
I can answer that,
it's
by the
renewed
way.
every year, basically, so this year funding they have cut based on their...
When you say this year, you're for the upcoming year or for this year?
Mr.
So
Grimm,
they're-
2018 to 2019.
in every contract
year?
with the state, there's what's called an executory clause. If they don't appropriate the money, we don't get it. So they don't really violate the contract.
Okay, so, because this is a 20% cut, I did the numbers, that's 20% cut in TB. What's the impact on that program?
Well, you know, as with many health departments, we're trying to do the same with less. We continue to have high numbers of patients that we evaluate for latent TB infection that we see in our clinic. Last year, we saw 291 patients evaluated through our clinical services and placed over 600 PPDs. The numbers of active TB cases are generally between 2 and 5, so there's not a lot of active TB cases in Albany County, but we do plan to continue with the commitment of the same services that we've been providing.
Because I was reading it, it's like a skin test and stuff like that. So will you be able to test the same number of people with less money?
Some people's jobs are there. You think so?
Okay, any other questions for Dr. Whalen? Hearing none, can I get a motion to approve?
I just want to say, could I say, Mr. Chairman, we got billions of dollars to build the Cuomo Bridge, and it's the state's priority to cut funding for TB.
Save that for next year.
Save that for
Just for the record, thank you.
Can I get a motion?
So moved.
By Joanne, second by Gary, all in favor? Any opposed? Unanimous. Okay, number 5. I'm sorry, number 4. Amending resolution number 497 for 2013, reflect the reduction in the original grant funding for maternal and infant health collaborative. Dr. Wellen?
Again, this is another cut that came down from the state level. This is the 4th year of funding for this grant. And we again remain committed to trying to provide the same services with less.
Okay, any questions for Dr. Wellen?
19%, yeah.
Yeah, this was cut from 339,000 to 274,000.
Can somebody ask
Are there any
the
personnel?
salaries?
What's that?
The salaries, how they
Yeah, so what we
reappropriate
did
them?
is, in the 2018 budget,
People's jobs depend on
we put the
some of these
reduction on
grants.
fringe and about $400 less in office supplies.
Wait, can you say that again? I'm sorry.
Fringe reduction is what we did, the reimbursement on our fringe rate, and then $400 in office supplies.
So when these kind of cuts in public health functions of the health department are imposed by reductions at the state level, are you cutting staff or services or both? And when you,
For this specific grant, we're not cutting any staff
Okay.
at all. We're just cutting the reimbursement that the state will give us back on our fringe. So
Okay.
they will be, I'm not sure how many staff members we have under the Mitch program, but their salary will be covered 100%, but our fringe rate will be cut, I think from 59%, we're getting to about 14%.
so that's a reduction in benefits for them as employees?
Not the benefits, they'll still receive their same benefits, it's just the reimbursement that the state will give the county,
And
if that makes sense.
and you're putting the reduction in next year's budget when you put it
Correct.
together, not this
Yes.
year? So
Yes, not
nobody
this year.
currently is going to be affected in 2017, correct?
Correct, because the grant year runs, I think it's from October
To September
1st
30th.
to September 30th, 2018,
Okay.
correct.
When these people were hired, was it made clear to them that as long as the grant's there, they're there?
Correct. Every
So the
time.
grant's not there no more, so now we're taking monies from other area to subsidize these, I don't even know the numbers. It's our understanding, it's always been our understanding, as long as these funded programs are through grant money, they're hired under the understanding, as long as the grant money's there, we can keep them employed. You didn't do that.
The grant money is there, it's reduced.
It's just not,
You know,
Well, you're taking money from other areas, from the budget, to offset the grant.
You guys haven't made a decision on the budget.
It's in the 2017, she's making these,
it's 2018.
oh, okay, so this is for next
Most of it
year.
is 2018.
Some of this is.
Some is this year, but the bulk is next year because of
months
how
is
the
this
grant year is.
How much is for this year?
October, November.
I think it's October 1st to September 30th, 2018, but I can double check.
Yeah, it's on, the state budget's not the same as the calendar year.
So next year's budget, it's gonna reflect the reduction.
Right, the
And
28th.
what about those, how many people is this affecting?
I'm not sure off the top of my head.
I know we have 3 community health workers, and I believe there's additional supportive staff for them. You know, when we get these kind of cuts, we have to have a real conversation about how we can continue to provide the services that are in keeping with our mission. This is a very important program that provides services to at-risk
Oh, I
moms
understand, we're
and
gonna have that
babies.
conversation
Yeah.
next year.
Yeah.
Trust me.
So, you know, I think that these 3 community health workers provided in excess of 700 visits to members of the community and helped loop them into services, whether it's healthcare, whether it's social services, counseling, et cetera, in order to try to improve
Oh, I
birth
understand, I think
outcomes.
it's a very important program.
Yeah.
But, you know, let me tell you something, the 2018 budget, it's gonna be very difficult. Very difficult. Sales tax revenue is down. I'm hearing that you're looking at a difficult budget coming. And I can tell you that. And you should start thinking that way.
Yeah.
And there's going to be a lot of programs that are very strong and very dear to a lot of us at this table. And it's not going to be like last year's budget, believe me. Thank you.
Any other questions for Dr. Whalen?
Can I just say, Mr. Chairman, the reason we would vote for a reduction is if we didn't vote for this, we wouldn't get any money at all. I mean, because it's a little odd that we're voting to amend the contract to get less money. But if we don't do it, we wouldn't get any of the money.
Right.
Just so people understand that.
That's correct.
Okay, can I get a motion to approve?
So moved.
By Joanne, second by Brian, all in favor?
Aye.
Any opposed? Thank you, unanimous. Number 5, amending resolution number 366 for 2015 regarding additional funding for New York State Department of Water Supply Protection for the Drinking Water Enhancement Program.
So this is good news. We got an extra $13,000 for drinking water. And this was from the New York State Department of Health. It's for $13,699 for 4/1/2017 to 3/31/2018 grant year. So this is something that, you know, has come about because of concerns in drinking water, both nationally and at a near local level.
Can
For the
you,
Uh,
state budget.
Go ahead, Joanne.
can you talk a little bit about what exactly this program is about? What, is it testing? Is it, what exactly is it?
So, in terms of, and I will say that I brought with us the 2018 report that talks about all our programs and services that can provide more additional information. We work with the county, or with the city and the municipalities to ensure that the standards for safe drinking water are upheld. We, permit wells, and we work with, on various issues with the state that concern drinking water. So in terms of this providing increased testing, that is not what it's for. We historically have done a lot more work than we are reimbursed for on this.
Okay.
So this will just help offset county share.
Okay. So it pays for activities you're doing with respect to compliance and testing that county
Yeah.
absorbs that is not covered by all of the state funds that come down?
That's right.
Okay.
Any other questions for Dr. Whalen? Sam?
Dr. Whalen, in my district, there's a lot of homes that have lead pipes going into the homes. I'm wondering if the health department has any programs, or if there's any programs available from the state to help homeowners or renters replace those lead pipes to make the drinking water safer. I'm also wondering, I've heard some concerns from residents of my district that some of the parks in Albany, the soil has lead in it. It's been tested and they found some levels of lead. I'm wondering if there's any programs to work with municipalities that have lead in the soil at parks to ensure that those parks are safe.
Well, the first question you asked is about reimbursement for the state has provided free testing for people that have concerns about their home drinking water. And so I would encourage anybody from your constituency that wants to get their water testing to do that first, and that can be sent off through the state. And we can facilitate that if people want to call and find out what resources they need to get in touch with how to set that up, that's fine. I don't think at this stage that they have provided any funding that I'm aware of, but I would have to double check about that for remediation in personal homes of plumbing fixtures. Most of the time, these are not necessarily large fixes. Sometimes there are joints that are soldered with old lead that just need to be replaced, so it depends. But certainly if anybody from your constituency has any concerns, they can call and let us know about it. The second concern you had about lead in playgrounds, we have a lead program that's very active, mainly dealing with concerns related to lead paint in older homes and children that may be ingesting lead in those circumstances. But if there are concerns from a particular area, you can let us know about those as well, and we can investigate that as necessary.
Okay, thank you very much.
Gary?
The city of Albany does, check the city of Albany, we have a program.
Okay.
And just a clarification, it's not the siding that they're doing. In the older homes in the city of Albany, the actual water line coming in off the main is lead. It's lead.
Not according to the water department.
Well, I could take you 5 houses right now on Washington Avenue. I own 3 of them where it's lead, all right?
Well, the
So
part in your home is lead, right?
the line that comes from the main to in your home is lead.
Okay.
It's a lead pipe.
Yeah.
And that's the problem, that's where the issues come from, But the city of Albany does have programs. Check them. Where in the budget is this $13,000 going?
It's going into our revenue line and then it's offsetting county share, so it's not,
I'm sorry, County
it's
what?
offsetting county share. So we're just putting it in our 2018 revenues, the extra 13,000.
Any other questions for Dr. Whalen?
Mr. Chairman, yeah. Are you consulted about these cuts? They said, well, we're going to cut these 2 here and add there. They said, well, let's check with the health director at all? No?
No.
Thanks, Mark. We get a motion to approve number 5 by Gil, second by Brian. All in favor?
Aye.
Any opposed? Brian?
No.
Oh, yeah. Gil?
I have a question. Commissioner, just out of curiosity, would you know what the cost of this program thing here is? Do you have any idea what this costs to make this up?
To print the...
Print this, yeah.
No. I can certainly get that information for you. Do you know, Shannon, off the top of your head?
We do this in-house?
Do we do this in-house?
I believe it's done through educational grant funding, but I can get that back.
Do we do it right here in-house? Do we have somebody who does this? Do we ship this out?
I'll have to check it for you.
All right, thank you.
I can definitely.
Great document,
check it.
Commissioner, though, because it provides a lot of the answers to the questions we hear. You know, when you talk about how many cases we have for different programs and services, it's, a lot of it's outlined right in these pages, so. Brian?
Mr. Chairman, Commissioner, while you're here, I was wondering if I could ask, could you give us an update on the status of the Toxic Free Toys Act? So we're within about 2 months of enforcement at this point.
Yep.
Last I had heard, we were hiring a consultant, or excuse me, not a consultant, a technician to come in and head up the education process up
Yep.
until November 1st. How's it coming?
That's coming very well. We have sent out letters to all of our local retailers to alert them to the changes and to let them know the regulations. They're aware of that. And we are geared up. We have, we're in the contracting process with the entity that'll be doing the testing. And we're geared up to start inspections for November 1st as we're supposed to do.
How many retailers have been contacted?
I'll need to get you that exact number. I know it was a pretty high number, and it was a challenge to kind of come to that, but I can certainly get you that number.
Okay. Are we going to do personal visits or just rely on the mailing for informing them?
We did mailing initially. We've received several questions, and, on all of the mailing that we did, we said, of course, provided our contact information. We have had several retailers call and ask questions, in particular about the attestation, and so we are answering those questions. It hasn't been terribly busy with calls so far, so I think that's encouraging. And we'll continue to educate retailers as we go out and do our assessments.
I did notice on the education process from my friend Mr. Miller's local law, Tobacco 21, that all the retailers were given a copy of the local law and got a visit.
Right.
Can we at least get a copy of the local law to these retailers?
We sent a copy of the local law when we sent them the letter.
Okay, so letter and copy.
Yep.
Okay.
Yep, we did.
And the technician's been on, is on staff and ready to
Oh,
go
yes,
for
she
November
is.
1st?
Yep, she's ready to go.
Okay.
She's all set.
Thanks.
Commissioner, we're back on this program. Who receives this? Just us here? Is all households in the county get this?
No, not all households in the county. I believe we print out about 500 of them, and we give them to community partners. This is in keeping with public health accreditation. This report has been issued from the health department. Actually, my secretary was cleaning out an ancillary office this week and gave me all the reports from 1960s. So this report comes out of the health department every year since there was a health department. It is put in place to both educate the public about the programs and services we provide and to let people know a little bit about disease rates in the community and problems that are affecting the community in the year that we publish them. So it is something that's very long-standing. We try to share it with community partners when we have people come to the health department, when we have our staff go externally to the numerous meetings within the community. We hand these out. So it's a very valuable document in summarizing the work that we do and the concerns from a health perspective, particularly communicable disease faced by Albany County residents.
But the residents don't actually see what is in this pamphlet?
Well, the residents it is posted online. It's posted on our health department website. So if anybody wants to have a look at it, it is located, there's a link to it right on the first page of our website. They're more than welcome to look at it. It comes out usually, I apologize, a little bit late in getting it to you. We usually get it out for the previous year in April. This year we had a little bit of a printer snafu, and then I think we didn't have a meeting last month. So I'm bringing it to you now, but it's usually in April of every year for the year previous.
Do you be able to furnish me with the cost of the whole thing?
Yes, I will.
Within reason, I don't care how long.
Sure.
And I would just say, I'm going to circulate the link on my social media, and I suggest to others to do that because, I'm not wild about having a lot of paper produced. These are available also at the libraries because the libraries have access to the internet for folks who don't. But that's important to promote that this is available online.
I also
I think I gave one to you from our last health board meeting, to you, and I think Ms. Willingham, I think you should have had a copy. No, I shared it with you that you used to write tablet notes on at another meeting.
Oh, yeah.
Remember that?
Yeah, I have
Look
it.
in that batch of papers, you got it.
Yep.
So I gave it to about half a dozen people at our, after our health board.
Thank you, Commissioner. I appreciate the program, so.
Thank you.
I see the executive in here 3 times, if you can try to get one picture of us for next year's report, that'd be nice.
I'll second that.
Very good. All right.
Editorially wise. From an editorial viewpoint.
Okay, number 6. Authorizing a memorandum of understanding with CSEA Local 801, or Department of Mental Health and Crime Victim and Sexual Violence Center Unit, and amending the 2017 budget. Ms. Roberts?
Thank you, good evening. Yes, we've reached an agreement with our union, and we're asking permission to enter into this, authorizing the memorandum of understanding. It's a 5-year contract. It has, from 2017 through 2021, has a 2% salary increase for each of the 5 years, retroactive back to January 1st of 2017. There's a few other minor changes to the contract.
Any questions, Gil?
No, I make a motion to accept.
Motion made by Gil, second by Brian. All in favor?
Aye.
Any opposed? Unanimous. Thank you.
Thank you.
Get a motion to adjourn? Gary, second by Gil. All in favor?